This is coming into the office. We're on the second floor. Come in, here's the reception room. This is where patients check in. We always run some type of video in the reception area. Then we come through this door. And here's the room that we do Zumba, yoga. We've had dance in here, okay, but it is the most underused area that we have. This table right here is called the decompression table. And the decompression table is great for cervical and lumbar disc bulges and disc herniations. Very effective treatment also for facet pain. This is the examination room. Faith is a CCPA, and she is able to do legally examinations. We do dual inclinometer testing, and we also have a foot scanner for orthotics from foot levelers. When new patients come in their second visit after we do the examination, they come back for a report. We show them a movie on that TV. And here's a plumb line with a bilateral weight scales that tells us whether or not their spine and weight are adapting. Drinking fountain. This is where Ronnie has his massage room. This is the restroom. Behind the curtains here is where we do passive care. Passive care is interferential, which is electrical, and also we use infrared light. The interferential relaxes the muscles, it increases the blood flow through the muscles, it helps sedate the area, and the infrared light is a vasodilator. We have 2 of these units, so we can handle 3 people at one time on passive care. This is where we do myofascial work. My wife Linda does that. Okay, there's an attached bathroom on this room. And she uses this machine called a Synergy machine. Very effective for myofascial lymphatic work. We use it a lot for people that have had trauma, okay, lymphedema, swelling. It just works great. A lot of people that don't respond to just straight muscles and adjustments, okay, have a myofascial disorder, and that reduces their symptoms. These 2 tables here, okay, are intersegmental traction tables. 99% of the patients love them, but what they do is they feed the disc, and when they feed the disc, they increase the spinal flexibility. It's a very comfortable treatment. We use it a lot. And here's the digital x-ray machine. We are able to burn the x-rays right to a CD if we want to. This is about 1.5 years old. Works fantastic. Don't have to store films. This is an extensilizer. An extensilizer is an old table. Okay, and it does a cephalic, okay, passive motion therapy. But what we usually use this for is a distraction technique. Okay, if you ever look on the website, the Houston Chiropractor, you're going to find he does a move called the ring dinger. I taught him that move. It's very good for spinal compression. Here's what we call our carpal tunnel machine. A lot of people that have hand symptoms are due to shortness of the muscles in the forearm, and so this is a forearm distraction device. The patient sits there, they strap their arm in, and this device right here stretches out the forearm. We routinely help people with trigger finger and hand symptoms with it. Okay, now we've got two vibe plates. This one's got the one with the handles for people that are challenged on balance. And this one, okay, is without the handles. We do functional exercises on this vibration plate. Okay, cervical, shoulder, rotator cuff activator, step on, step off, squats, balance. We do a series of exercises, takes about 10 minutes. Here's one of our unweighted treadmills. The patient wears a vest. They go forward, sideways each way, and backwards. They go forwards for 5 minutes, sideways each way for 2 minutes, and then 3 minutes going backwards. We have Parkinson's people on it. We have sports performance people on it. We have almost all our lower back people on it. Most people have pelvic instability that we see, and a lot of it has to do with poor motor function. We have 2 of them. And then we have a rocker board here, and we use a rocker board for foot proprioceptive training. This is these 3 are back systems. Okay, this is the original that unloads the lumbar spine while, okay, you go through either upper or lower extremity maneuvers. Okay, what it does is it improves the firing pattern of either the upper or lower extremity if you use your belly to go back and your butt to come forward. Here's a Pilates table that we don't use. It's a reformer, okay, with a half trapeze. Here's a Rotex we use for restoring more normal hip function, okay, the small muscles of the hip. We don't use that enough. I've got a plumb line in here, okay, that I check on patients. This is where I adjust patients. Okay, I adjust patients with either my hands, a drop piece, which is on the table, or this adjusting instrument right here that stops when it feels a change in the resistance of either the joint or the soft tissue. And then last but certainly not least is our business office. Okay, this is where all the paperwork gets done. Okay, the billing occurs. These ladies here work in the office. That's Faith on the phone. She's our office manager, does all the insurance. There's Joanna. Okay, she checks people in and out, and that's Noelle. Okay, that works the therapy department.